Hi everyone, this is Dr. Brown and this is the 8th lecture in my series of sessions, and today's lecture is entitled Chronic Inflammation. So before I make a start, I just want to tell you that you should have all received feedback now for the first tutorial that you did back at the end of January. I think I provided feedback for everyone. If you have any comments or questions about the feedback that I've left, please don't hesitate to get in touch with me. Generally speaking, you all did really well, so well done on that. So if we move on to today's lecture, if I just get the pointer up. So the contents for today's lecture is ultimately on chronic inflammation. So we talked about acute inflammation in the last session, and today it'll be on chronic inflammation. So we'll highlight what the key differences are between the two types of inflammation. I'll provide examples of the 3 different types of chronic inflammation that you can actually get, and I will provide examples for each of these 3 types of chronic inflammation. And these examples are periodontitis, autoimmune diseases such as rheumatoid arthritis, and also this third disease, which is known as orofacial granulomatosis, or in short, this is known as OFG. And then in the second part of the lecture, what we'll talk about is chronic inflammation and tissue destruction, which is a characteristic of chronic inflammation. And specifically, we'll use periodontitis as an example. So this tissue destruction can occur either within the soft tissues or the hard tissues of the oral cavity. So we'll cover that in the second part of the session. So the first thing I want to talk about is the key differences between acute and chronic inflammation. So we should know from the last session that acute inflammation is ultimately the complete restoration of tissues. On the other hand, we have chronic inflammation, and this is associated with a greater tissue destruction. Ultimately, persistent bouts of acute inflammation can lead to chronic inflammation. Generally speaking, in chronic inflammation, the inflammatory infiltrate is a mixture of macrophages and lymphocytes, whereas in acute inflammation, it's your neutrophils, which are much more prominent. Chronic inflammation can ultimately occur in unison with this process of healing by repair. So this is a diagram, a flowchart that you saw in the last session, where acute inflammation and certain acute inflammatory diseases are associated with abscess formation. But generally speaking, in acute inflammatory diseases, you get resolution of the disease. And these are the 2 components that we're going to talk about in today's session and also in the next session, the healing and repair session in lecture 9, where basically chronic inflammation can occur and proceed in unison with healing by repair. So we'll talk about that in a lot more detail in today's and the next session. But the take-home message is, and it's something that you need to be aware of when it comes to your revision, is that acute inflammation occurs rapidly. So within days, this involves ultimately your innate immune cells, whereas in chronic inflammation, this is a lot more persistent, can occur over the course of weeks and months and possibly even years, or in certain diseases can actually go on forever. So things like autoimmune diseases such as rheumatoid arthritis can, once the disease has occurred, it can basically continue throughout your lifetime. So as I've said in the last slide, there's 3 types of chronic inflammation. So these can either be non-specific or specific. So the non-specific types of chronic inflammation are characterized by a failure of the immune system to resolve an acute inflammatory disease or an acute inflammatory response. Generally speaking, this is persistent bouts of acute inflammation, and in certain cases, depending on the disease, this can be excessive formation of abscesses. And a really good example for non-specific chronic inflammation, and we'll come on to talk about this in a few slides, is the shift from gingivitis into periodontitis. In certain cases, chronic inflammation can arise without prior warning, and this ultimately is termed arising de novo. And this can arise from a persistent exposure to a certain agent, whether it be a foreign particle or an actual microbe. And a good example of a specific chronic inflammatory disease is an autoimmune disease such as rheumatoid arthritis. And we'll talk about that in a few slides as well. And then the third type or the third class of chronic inflammation is the formation of these granulomas within a certain disease. So this is just a subset of specific chronic inflammation. And in certain diseases, and OFG, as I mentioned in an earlier slide, is a good example of chronic granulomatosis inflammation. So basically you have non-specific types. This is ultimately where you have acute inflammation leading into chronic inflammation, or you have specific types. And this can either be out with the formation of a granuloma or can involve the formation of a granuloma. So non-specific chronic inflammation in most cases arises when acute inflammation cannot resolve itself. In most cases, acute inflammatory disease can, but this isn't always the case. And ultimately, chronic inflammation can arise from acute inflammation when the immune system is not sufficient enough to eradicate a certain stimulus, depending on what that is. As I've said, the infiltrate is dominated by tissue macrophages. So tissue macrophages have a slightly different function to your classical macrophages, which we've talked about in previous sessions, and we'll talk about that today. And T cells and B cells as well. So basically your adaptive immune system, your adaptive immune cells play an important role in chronic inflammatory diseases. Non-specific chronic inflammation is characterized, as I've said, by this dynamic balance between tissue destruction and tissue repair. And we'll come on to talk about that in the second part of today's session in a bit more detail. And ultimately, the disease can arise from repeated acute phases and chronic phases with ongoing repair. So basically, persistent bouts of acute inflammation can lead to chronic inflammation. And whilst that process is occurring, you're having some level of tissue repair going on as well. So as I've always said in my sessions, I want to try and provide to you some example of an oral disease that can maybe help you when it comes to your revision sessions. So a good example here is periodontitis. So periodontitis is a good example of chronic inflammation. I won't spend too long on this slide. So this is something that we've covered in previous sessions. So you have initiation of the disease, progression, amplification. And in acute inflammatory diseases such as gingivitis, you will get healing and repair. However, if the disease doesn't heal and repair itself, and you don't get resolution of the disease, then chronic inflammation can arise. And a good example, as I've said, of chronic inflammation is periodontitis. So moving on to the second type of chronic inflammation. So this is your specific chronic inflammation. So this can either involve granulomas or there can actually be no granulomas being formed within a certain disease. These are characterized by excessively activated macrophages that have slightly different functions, as I've said, to your classical macrophages. And they can either be induced by non-immunological agents, so essentially foreign bodies that the immune system is encountering within the human body. And these can be things like maybe wood, grit, metal, if you're talking about wounds, or certain fibers that can be inhaled, such as silica and asbestos. Or they can be induced by immunological agents, so infectious organisms that can grow in cells, such as intracellular bacteria like Mycobacterium, or things like viruses as well. Certain hypersensitivity reactions can also be an initiating factor of specific chronic inflammation, and we'll cover these in the last session. And then you also have autoimmune reactions as well. And that is probably the best example when we're talking about specific chronic inflammation, is these autoimmune reactions. And the best example is rheumatoid arthritis. And we'll talk about that in a few slides. So we should be aware now that autoimmune diseases, as I've said, are good examples of this type of chronic inflammation. It's basically characterized by an unwanted response by the body's own cells and tissues to ultimately host tissue or to commensal bacteria. So basically your immune system is attacking either the host tissues or commensal bacteria. It can be characterized by this loss or breach of tolerance to self-antigens or commensal bacteria, as we've covered in quite a bit of detail in the adaptive immunity lectures. There's multiple mechanisms in place to basically try and prevent autoimmunity from arising. So recall these processes of positive and negative selection, whether we're talking about central tolerance in the bone marrow or the thymus, or peripheral tolerance, which can arise in secondary lymph nodes or secondary lymphoid organs such as lymph nodes. This is where basically your T cells and B cells will undergo this process of positive or negative selection. And generally speaking, autoimmune diseases arise from this sustained immune response, so ultimately chronic inflammation. So you've seen this table before, just a list of all the different types or all the different examples of autoimmune diseases. So what we'll talk about in the next slide is this one here. So rheumatoid arthritis is probably the best known autoimmune disease. And this ultimately arises from autoreactive T cells against antigens of the joint synovium. So basically components of the joint are attacked by autoreactive T cells. And a consequence of this is joint inflammation and destruction, ultimately leading to arthritis. So I've picked rheumatoid arthritis as an example here because you may or may not be aware that there is causal links between oral diseases such as periodontal disease and the onset and severity of rheumatoid arthritis in certain patients. And this schematic diagram here just highlights the links. So you have in certain patients periodontal disease. We should hopefully by now appreciate that it's certain microbes within the oral cavity, within the oral microbiome, that can drive this disease. A good example is Porphyromonas gingivalis, which is known as the keystone pathogen in periodontitis. P. gingivalis infection can lead to not only local inflammatory responses, but also systemic inflammatory responses as well. In addition to that, you have the production of enzymes such as proteases, also known as gingipains, but also PAD enzymes are produced by P. gingivalis as well. So PAD enzymes stand for peptidyl arginine deaminase, and these are not only naturally produced by host cells such as neutrophils, but they're also produced by P. gingivalis as well. And as far as I'm aware, P. gingivalis is the only organism that has been found within the oral cavity that can actually produce these enzymes. And the primary role of these enzymes is to citrullinate peptides. So hopefully you are aware that there's 20 different types of amino acids that you find within the human body. And each of these amino acids can basically be combined to produce a certain protein. What this PAD enzyme will do is basically drive the citrulination of an arginine residue within a certain protein into a citrulline. And citrulline is not a naturally occurring amino acid. So if the immune system encounters citrulline, then it will basically attack it. The immune cells, such as B cells and T cells, will basically attack any proteins that have citrulline in them. And that is essentially one of the links between periodontal disease and rheumatoid arthritis, is that you get this loss of tolerance in certain proteins or to certain proteins that have this citrulline within their structure. And because PAD enzyme and P. gingivalis producing this PAD enzyme, this is essentially why scientists are trying to find the link between them, because you get this buildup of or this production of antibodies against these citrullinated proteins. And these proteins can basically build up within, these citrullinated proteins can basically build up within the joint synovium of individuals, where basically the immune cells will attack these citrullinated proteins within the joints. And that is ultimately why there is a link between periodontal disease and rheumatoid arthritis. Although we don't know the specific mechanisms as to why this arises, there's certain people, certain scientists have postulated that things like PAD enzymes can actually build up within the tissues. So these PAD enzymes can get into circulation and build up in the tissues. Other scientists have found that there's actually remnants of P. gingivalis, of the P. gingivalis microbes actually found within the joints. But basically, the sort of take-home message from this slide is that you get the production of a foreign particle, or the equivalent of a foreign particle. This citrullinated peptide will basically be targeted by the immune system because it kind of comes across as a foreign body to the immune system. And this is ultimately why rheumatoid arthritis can arise. So the third type of chronic inflammation is the formation of these granulomas. So they differ from normal chronic inflammation as these contain modified activated macrophages. So these macrophages are a lot less phagocytic in nature. So macrophages, hopefully you know by now, their main role is to phagocytose and present antigen. The macrophages within granulomas are actually a lot more secretory in nature, so they produce a lot more cytokines and chemokines to basically instruct other immune cells what to do. So these macrophages are known as epithelioid macrophages, and ultimately they're multinucleated, they're giant cells, so they're formed from different macrophages essentially fusing together. And these macrophages will produce proteins, cytokines, to basically instruct B cells and T cells what to do within the tissue. And we'll talk about that in a few slides. So there's two main causes of these granulomas being formed. So they can either be immunological in nature. So certain delayed hypersensitivity reactions can lead to this inflammation. Or you also have invading pathogens, which cannot be cleared by an effective immune system. So these microbes that can actually evade the host immune system and persist within the tissue. Some good examples would be tuberculosis or leprosy. So basically very lethal, dangerous organisms that the immune system can't clear on its own. These granulomas will basically form around those microbes to actually prevent those microbes from spreading within the body. On the other hand, they can also be non-immunological in nature. So again, these can be either foreign bodies within tissues. A good example, particularly probably not nowadays, given that asbestos is no longer present in buildings, but asbestos particles can, if they get into, let's say, lung tissue, granulomas will form around these asbestos particles, preventing them from spreading. So this is a bit of a recap. So we're obviously talking about the importance of macrophages within granuloma formation. We should know by now macrophages phagocytose and present antigen, and there's two different types. So you have pro-inflammatory macrophages or anti-inflammatory macrophages. So M1 or M2 macrophages. And basically it's the balance between the two types of macrophages, which is important in this idea of tissue homeostasis, which we've talked about before, but specifically this idea of injury versus repair within chronic inflammation. So these have unique cytokine profiles. So the M1 macrophages produce pro-inflammatory cytokines, which can drive toxicity within the tissue and also promote tissue injury. Whereas your M2 macrophages produce anti-inflammatory cytokines and also growth factors as well. And these growth factors can drive the process of tissue repair within the tissue. And it's ultimately the balance between the two, which is important to consider when you're talking about macrophages in chronic inflammation. So on the left-hand side, you have tissue injury. So these macrophages will produce things like proteases, certain chemokines that can drive the recruitment of neutrophils. They can drive the process of coagulation. So we talked about that in the last lecture, the coagulation system being important in the formation of blood clots. Macrophages can also contribute to the pool of arachidonic acid metabolites. So arachidonic acid will lead to things like prostaglandins and related compounds being produced. So recall from the last session that prostaglandins are important in driving vascular dilation. So basically driving immune cells recruitment into the tissue. And then on the other hand, you have your M2 macrophages, which can drive the process of fibrosis. This is something we'll talk about in the next lecture, where basically you have fibroblasts that can synthesize extracellular matrix and collagen, which makes up the connective tissue. So basically driving this formation of new tissue. And the macrophages can also contribute to the pool of other growth factors as well, which can actually have an important role in this process of angiogenesis, so the formation of new blood vessels within a tissue. But we'll cover this whole process here in a lot more detail in the next lecture, in the healing and repair lecture. So just to give you an example of this third type of chronic inflammation, so granuloma formation is characterized here. It's a nice diagram to just highlight what happens. So you have these epithelioidal cells, these sort of modified activated macrophages within the tissue. These cells will basically interact with lymphocytes such as T cells and B cells to try and fight in a certain infection. And then surrounding these granulomas, you have the formation of connective tissue. So these fibroblasts will basically try and repair the tissue by producing and synthesizing connective tissue. And this process is ultimately occurring within the formation of a granuloma. So you have macrophages interacting with lymphocytes. Lymphocytes will produce certain cytokines, which will basically induce the formation of these epithelioid macrophages. These macrophages will then contribute to the formation of this, what is known as a giant cell. And these giant cells will basically continue to engulf foreign material and then present them to T cells. And this is basically a cycle that is going on during the formation of a granuloma. And as always, I want to give you an example of this. OFG, as I've said, is an ideal example of a chronic granulomatosis type of inflammation or type of inflammatory disease. So granulomas within this disease are characterized by the formation within soft tissues of the oral cavity. You get swelling of the tissue. And OFG has links with, or at least has very similar clinical presentations to Crohn's disease. So Crohn's disease is something you've probably heard of, arising within the GI tract. So basically inflammation of the tissue of the GI tract. And there's links between OFG and Crohn's disease. So basically if certain patients have intestinal Crohn's and also these clinical presentations within the oral cavity, then it'll be known as oral Crohn's. If there's no sign of intestinal Crohn's disease, then you basically just get OFG. But basically oral Crohn's and OFG have very similar clinical manifestations. And this ultimately goes back to the idea and the importance of understanding your patients, not only your patient's oral health, but also your patient's systemic health as well. And hopefully you are aware that this idea of the surgical sieve, understanding any sort of underlying problems that a patient may have, should hopefully help you understand or should help you make the correct diagnosis within a certain oral disease. So midway recap, acute inflammation is a fast, rapid response, predominantly involving neutrophils and other innate immune cells. Chronic inflammatory response is a lot slower, but more persistent responses, Generally, these include tissue-resident macrophages and also your adaptive immune cells, such as your T cells and your B cells. There's three main classes of chronic inflammation: non-specific and specific, either involving the formation of granulomas or out with the formation of granulomas. There's an essential role for macrophages, particularly this idea of the balance between M1 and M2 macrophages. And this balance is important and essential within the idea of tissue injury versus tissue repair. This is something we'll cover in the next session. And then finally, be able to provide examples of each type of chronic inflammatory disease. So periodontitis, an example of non-specific. Autoimmune diseases such as rheumatoid arthritis is an example of specific chronic inflammation, whereas OFG is an example of specific chronic inflammation characterized by the formation of these granulomas. So that concludes part A of the chronic inflammation lecture.